Most people turning 65 don't realize this. Medicare is actually two very different paths. And choosing the wrong one costs you a lot more than expected. Hi, I'm Kevin Wilson with Green Country Medicare Advisors here in Oklahoma. If you're turning 65, retiring soon, or just trying to understand your Medicare options, this video is for you. One of the biggest questions I get is what's the difference between Medicare Supplement and Medicare Advantage? And which one is better? And the truth is, there's no one size fits all. So in this video, I'm going to break down Medicare 101 for 2026, explain parts A, B, C, and D, go over the deductibles and cost sharing, and then compare Medicare Supplements to Medicare Advantage in a way that actually makes sense. All right, let's jump in. First, let's start with the basics. Medicare is a federal health insurance for people age 65 and older, and for some younger individuals with disabilities. Original Medicare is made up of Part A and Part B. Part A is your hospital coverage. It helps cover things like hospital stays, skilled nursing facilities, hospice, and some home health care. Most people don't pay a monthly premium for Part A, but there's a deductible. In 2026, the Part A deductible is $1,736 per benefit period. Now that's important. This is not yearly. It resets based on your hospital usage. Part B is your medical coverage. This includes doctor's visits, outpatient care, lab work, preventative services, imaging, and medical equipment. In 2026, the Part B premium is $202.90 a month for most people. There's also a yearly deductible of $283. After you meet the deductible, Medicare typically pays 80% and you're left to pay 20%. Part D is your prescription drug coverage. You can get this as a standalone plan or it's included in many Medicare Advantage plans. In 2026, the maximum out of pocket for drugs is capped at $2,100. And finally, Part C is Medicare Advantage. These are plans offered by private insurance companies that replace how you receive your Medicare benefits. Most of them include medical coverage, drug coverage, and extra benefits like dental, vision, and hearing. Once you're on Medicare Part A and B, you have two main options. Option 1, stay on original Medicare, add a Medicare Supplement, and add a Part D drug plan. Option 2, switch to a Medicare Advantage plan. That's the fork in the road. And this is where most people get overwhelmed because both options can be good, but they work very differently. If you have only original Medicare, you pay the Part A deductible, $1,736. You pay the Part B deductible, $283, and then typically 20% of your medical cost. So if something major happens, your cost can add up quickly. That's why most people choose either a supplement plan or an Advantage plan. Let's start with Medicare Supplement, also called Medigap. This is extra insurance that helps cover the gaps in original Medicare. The most popular plan is Plan G. With Plan G, you pay your monthly premium, you pay the Part B deductible, the $283, and after that, most Medicare approved costs are covered. So for a lot of people, it feels very simple. I pay my premium, I pay my deductible, and that's about it. Here's why people choose that option. You can go to any doctor in the country that accepts Medicare. No networks, no referrals, very predictable cost. This is especially popular for people who travel or want flexibility. The trade-off is the monthly premium, and you also need to buy a separate Part D drug plan and dental or vision if that coverage is needed. Now let's talk about Medicare Advantage. These are private plans that take over your Medicare coverage. The biggest reason? Lower monthly cost. Some plans are even $0 per month. Instead of paying a higher premium, you pay as you go with co-payments and co-insurance. That includes things like doctor's visits, specialists, hospital stays, tests, and procedures. Here's the key protection. Medicare Advantage plans have a maximum out-of-pocket limit. Once you hit that limit, the plan pays 100% for the rest of that year. That's something original Medicare does not have built in. Now, let's break this down simply. HMO versus PPO. HMO plans are the most restrictive. You typically must use doctors in the network, and you often need referrals to see specialists. Then there's the PPO. PPO plans give you more flexibility. You can go in network or out of network, but out of network usually costs more. Then there's also private fee for service. PFFS plans are different. The plan sets the payment terms, and the provider has to agree to accept them. So before getting care, you need to make sure the provider accepts that plan. If you want the easiest way to remember this, an HMO is the most restricted, but is going to offer the lower copayments. The PPO, more flexible, but a little higher copayments. And the PFFS, provider must agree to the terms. So which one is better? It depends on the person. People who want predictable cost, people who travel, people who want maximum flexibility, a supplement can be better. Now, people who want lower monthly premiums, people that are okay with networks, and people comfortable paying as they go, an Advantage plan may be better. This part is very important. When you first enroll in Medicare Part B, you have a 6-month window to get a supplement plan with no health questions. After that, you may have to go through underwriting. So your first decision really matters. Let me simplify this. Person A chooses a Medicare Supplement Plan G. They pay their monthly premium, they pay their Part B deductible at the first of the year, and there's very little else they're going to pay. Person B chooses a Medicare Advantage plan. They pay much lower monthly cost, but they're going to pay copayments when they use the services. So the trade-off is the higher monthly cost for the lower usage cost versus the lower monthly cost for the higher usage cost. I hope this helped make Medicare a lot easier to understand. If you're in Tulsa or anywhere in Oklahoma and want help comparing plans, I'd be happy to help. I'm Kevin Wilson with Green Country Medicare Advisors, and as an independent agent, I can help you compare all your options. If this video helped you, make sure to like, subscribe, and leave a comment with any questions. And I'll see you in the next video.